hazards from snow days happen on more than just the roads. The number of people seeking medical care for injuries typically goes up in slick conditions from ice and snow. News 5's Bill Folsom is joining us live in the Rock Rimmon area of Colorado Springs with some cautions from medical pros. Bill.
Yeah, Diane, the sun, it has just gone down, and conditions, well, they're going to change again here. We're watching it happen right here. If you look up, there's a clear area there at the bend in the road. There's some dry in there, but also wet, and that's starting to freeze. And then as you turn to your left there, you can see that part of that road never really cleared today, and definitely the sidewalks did not clear, and who knows what's underneath on those sidewalks, whether there's traction or if it's slick underneath. Out this afternoon, we found crews still working on shoveling and plows working to clear drives. Even though snow gets cleared, it's cold enough for the icy conditions to linger for quite a while. We spoke with Dr. Ian Tolberg at UC Health Urgent Care, who tells us it's typical to see more patients when a snowstorm moves through. Patients often report stepping out to do something simple like get the mail or walk the dog, and then suddenly they're down.
We really need to take those a whole lot more seriously. So bones break really easily. A lot of trauma that you're not even paying attention to. So hit your side a little bit. There might be some broken bones. Might start having a little bit of internal bleeding. Things like that can absolutely happen, and unfortunately a lot of folks just overlook those things, but we pay attention to them very carefully.
There are broken bones, sprains, lacerations needing stitches. When someone hits their head, the injury can be less obvious, and that can be something that's happening, a concussion, or sometimes there can even be bleeding inside the skull. It is something to pay attention to, not to ignore. Dr. Tolberg says really the highest risk group on that who should really not hesitate to get checked out is people who are over the age of 70. So the storm is moving out, stopped snowing here, but the aftermath, it is here for a while. In fact, Dr. Tolberg tells us they often see patients coming in for a week or more after a storm. It's people who maybe fell and thought, well, I'll get better, and they're not, so they think they need to go get checked out. And then you have the snow, the freeze-thaw cycle that sticks around, and people continue to get injured. Reason to continue to be cautious. In Colorado Springs, Bill Folsom, News 5.